Good morning. The present work is titled Optimization of gram stain for its application in tissues, and it was carried out by the Department of Pathology of the Autonomous University of Nuevo. Well, for starters, as you may know, gram stain is one of the most universally used techniques for microbiological diagnosis due to its simplicity, effectiveness, and speed. It allows to distinguish bacterial morphology based on the chemical and structural compositions of their cell walls, and it distinguishes between gram-positive bacteria, which are stained purple, and gram-negative bacteria, which are stained pinkish or red. Although conventional gram stain works very well with smears from liquid samples, its use is not appropriate for tissue sections since connective tissue and other elements of biopsies stain easily and non-specifically, which complicates the visualization of the bacteria. For tissue sections, the standard stain for histopathological evaluation is hematoxylin and eosins, since it allows recognition of the inflammatory pattern associated with bacterial infections. However, this technique is not designed to differentiate between gram-positive and gram-negative bacteria. Therefore, modified gram techniques have been developed for its application in tissues. For example, Becerra and collaborators modified the traditional gram stain with a very similar approach, and they managed to increase the contrast between the bacteria and the tissues. However, the downside is that morphological details are often lost. Another modification of the gram stain is the brown hop techniques. Here, the gram-positive bacteria stain blue and gram-negative bacteria stain brown, pinkish red, and the surrounding tissue is stained yellow. As well with the previous modification of the gram stain, the ground hop techniques has the disadvantage that important morphological details that would allow the inflammatory response to be associated with the infection are lost. Therefore, the objective of this work was to optimize gram stain to be able to detect bacteria in histological sections where the morphology of the tissue can be appreciated, thus increasing the possibility of observing histopathological pattern underlying the disease. The methodology consisted in obtaining serial sections of patients with mycetoma or pyelonephritis. These sections were deparaffinized in silo and hydrated in decreasing concentrations of ethanol. The sections were stained using conventional gram stain reagents following concentrations and times according to standard protocol, and they were immersed in tap water for 2 to 3 hours depending on the tissue. This step constitutes the critical step for our optimization parameter. Well, then the slides were dehydrated and mounted. We also performed the ground hop stain as a reference. Here the results, these mycetoma sections were stained using our optimized technique. And as you can see, the tissue releases the excess dye as time progresses, with A being the shortest time, followed by B, C, and D. And as you can see, as time passes, the contrast improves and allows to differentiate the bacteria while at the same time conserving the tissue morphology. This is previous D slide higher magnification, and highlighted by the arrow are gram-positive cocci, while the tissue simultaneously can be appreciated by its morphology. These sections correspond to pyelonephritis samples. This figure shows a comparison between our optimized gram stain here on the left and the brown hop stain on the right. As you can see, the morphology of the tissue and the lesions caused by the infection, which are pointed by the arrows, can be best appreciated with our optimized stain. In the brown hop stain, although the contrast is increased for the bacteria, the morphology cannot be appreciated. While in our optimized stain, you can appreciate the morphology while at the same time also observing the bacteria present. This image shows our optimized gram stain in a mycetoma section in tissue that was not damaged by the infection. You can appreciate the gram-positive cocci while at the same time it can be seen the inflammatory infiltrate in the tissue, which could not be observed otherwise with the other stain. Well, often many improvements made in staining techniques come from simple changes that may seem obvious. For example, Becerra and collaborators for their modified gram stain only added alcoholic saffron when dehydrating tissue. By modifying this simple step, they achieved to improve significantly the contrast between the tissue and the bacteria. In our optimization technique, our critical step was to immerse the tissue in tap water, and this to allow the tissue to access the release time and improve the contrast. Our optimized gram technique could be applied to detect bacteria in cases where infection is suspected. It is important to mention that for clinical interpretation of the tissue, certain precautions must be taken, especially in cases where there exists necrosis in the tissue, which could affect the bacteria. They could be dead or with damage to the cell wall, and therefore they reflect a different staining pattern. We believe that our technique has potential for application in histopathological diagnosis, as current pathologists continue to use H&E as a standard staining for detection and classification of bacteria. And this technique is not appropriate for gram classification of bacteria, which might lead to an incorrect or inconclusive diagnosis, since it's not designed for that purpose. Considering all this, gram stain tissues could be great support when choosing the initial antibiotic treatment, and thus avoid unnecessary use of broad-spectrum antibiotics, and instead help choose a more focused treatment. And to conclude, the gram stain optimized in this work allows the unambiguous detection of gram-positive and gram-negative bacteria in tissues, while allowing the appreciation of tissular morphology. Therefore, this technique could be of great support in the clinical setting for histopathologists in the diagnosis of infection due to this type of